today is communication skills for pharmacists, building empathy and rapport. So this is actually a very important, as Laura mentioned. This is actually a very significant topic, regardless whether you are working in a psychiatric field or not. And actually, building empathy and rapport is day-to-day skills that actually needed. Again, regardless in which field you are in, even if it's not, even if it's not in medical field. So okay, so what is empathy? So we heard the word empathy. I believe we all have heard it and so many times. But what is it actually? So empathy is actually an ability to share someone else's feelings or experiences by imagining what it would be like to be in that person's situations. So I think we all have heard this, try to put yourself in that person's shoes. So this is what empathy is. Okay, so in this field, I would say it's communicating with patients to understand their perspective on their disease, on their medications and overall health, and addressing patients' emotional response, as well as acknowledging their concerns or frustrations. So there is a difference actually between empathy versus sympathy. So normally we will use it together, I would say, but the meaning itself is actually quite different. So empathy is actually understand the feeling of another, but not necessarily share them. Okay, so but sympathy is actually sharing the feelings of another person's. One example that I can give you is, for example, if your friends or your loved ones, actually, your friends, for example, lost a loved one, you will send them a sympathy card, right? So a sympathy message. So you actually saying that I feel sad. So you actually share the same feelings, that you too feel the sadness. So there is more of sympathy. Empathy is actually understanding where is that feelings come from. You may feel the same, you may feel the other person, or you may not. And it's okay if you don't feel the same feelings. Okay, so see their world, put yourself in their shoes, understand their feeling, communicate understanding, and accepting them non-judgmentally. So accepting them non-judgmentally is, I would say, the goal actually, why you need to empathize with others, so that you would understand and not to judge them based on your perspective or your understanding. Okay, so again, try to put yourself in their shoes, and when you try to convey this empathy, so we will go to that further in a while, but basically when you try to convey this empathy, you try to look at the person. Okay, it depends whether the person wants to look at you or not, but don't force them. Okay, not forcing. So you look at the other person so that the other person feels that you are trying to understand them. Okay, and full attention on the person. This is very important. So sometimes we avoid eye contact, for example. We, even though actually we are listening, but we try not to look at the person for whatever reason. So that actually maybe giving a message that you are not paying full attention on the person. So therefore the empathy is not conveyed there. Okay. So what are the pitfalls of the errors that are normally, not to say just pharmacists, not to say people are working over the counter, but we all sometimes do this. Okay, so what are the pitfalls in conveying this empathy? ignoring patients' emotions. So that's the first step, I would say. Do not ignore the other party's emotions. Okay. So sometimes we try to ignore it because it's a bit uncomfortable. Yeah, when you are not used to deal with emotions for whatever reason, maybe that is how you are. Not everyone is comfortable with emotion. Okay, so uh, but when you ignoring the patient's emotions, um, it can be a little uncomfortable for the person. So you might ignore, or you might rushing the interactions. So when you rush the interaction, when you ignore, the patients might feel like as if it is a burden to the pharmacist, or unintentionally embarrassing the patients. So they might feel, I think we have this experience sometimes when we try to say something, so the person the person is ignoring it. So we feel embarrassed, like, oh, did I say something wrong? Or why is this person just dismissing my emotions, my thoughts, my ideas? So that will um actually hinder the convey, I would say, the to show that you are being empathized there. So yeah, so the pitfalls here, the errors: do not ignore the patient's emotions, and do not rushing the interactions. Okay. Again, don't ignore simply because it can be a little uncomfortable. You have to face it. Okay, and maybe try to say things like, it's okay to be upset, tell me more if you're comfortable. So that. Okay. So showing empathy. Um, Empathy is actually an understanding. So but if you do not show it, so people will know. Maybe you can understand, but if you don't show, the other party might not get the message that you do understand them. So there are 5 ways as into how you can show that you are understanding the patient. Okay, so the first one is show respect. Showing respect is actually is to receive respect as well, I would say. Okay, so respect is one of the most important therapeutic core qualities, I would say, in addition um, genuineness and uh, being like part of empathy as well. So showing respect is important because the patient needs to respect you as well, even though it is in a very short um, interactions. I know, like for psychologists or even psychiatrists, we might have sessions, longer sessions with patients. For pharmacies over the counter, for example, maybe it is more or less than 15, the longest, perhaps. So it's quite limited. So it might not get to the extent of therapy sessions is, but um, but still, the respect is important because the patient needs to respect you at that moment, okay, over that counter. So whatever you tell the patients, they will somehow take it seriously, and also they will have that trust. So that's why respect is very important. So the second one is encourage patients to express themselves. This again, um, if you encounter a patient, a psychiatric patient, for example, that might be very agitated or very anxious. Okay, so anxious patients, they might have very serious concern over medications. What if I take this? What if I stop taking this? So how many times? Maybe they have asked this question, or maybe you have mentioned it to them. You have to take this medication. this time and at this time, how many, but still they kind of ask you again. So how many times? So maybe they will ask you a few times. So address that, like ask them why you are so worried. If they open up, ask them to tell me more. Okay, why you are worried? Tell me more. It's okay if you are upset. It's okay that you are anxious. But this is so assure them so it's okay. Okay, so that's how you show it. And put yourself in the patient's shoes again. So understand that they have these issues, these psychiatric issues. If they are very demotivated, like uh, mm, why should I take this medication? Why? Uh, it means nothing. I don't want to. Um, it doesn't make any difference if I take this. So I do understand. Maybe you have other patients that lining up to get their medications, but try to understand their issues there, um, and try to address that. Okay, and okay, recognize and address patients' fears. Okay, so if they are scared, why? What what is the thing that they are scared? If they feel that they are comfortable with you to open up, then maybe you can address that as well a bit, um, to the extent of your knowledge. Okay, and try as best as you can to comfort the patients that it's okay, all right, I understand. So use interchangeable and additive responses. So what does it mean by interchangeable and additive responses? This is maybe um, in a longer sessions, I would say, like uh, if you have time, or maybe if you see inward patients and you are advising on certain medications. So use interchangeable and additive responses means like restatement of patient word, paraphrase, so that they feel that you understand them and you actually listen to what they say. Okay. For example, maybe you can use words like it's common to worry about that, and then try to comfort or try to reassure. And responses actually have two components of responses, I would say, when you want response to patients' concern, for example. So one is comprehension. Comprehension is more like you understand the situations and restate. So that, and also educated guess might work as well. If you feel that, so educated guess is like, oh, because so I believe maybe you are worried because of this. So if the patient is comfortable with you, patient might correct you, patients might then they might open up. Oh no, actually, so there's more information there that you can get to understand the patient more. Okay, so there is empathy. Okay, so now we go to rapport. So rapport is a connection or relationship with someone else. It can be considered as state of harmonious understanding with another individual. Rapport actually need to be built, and empathy is part of rapport. So with empathy, the rapport building is easier. Okay. So building the relationship. Okay, there are three components here in building the relationship, in building the rapport. So first one is verbal, the second one is non-verbal, and also appropriate confidence. So all this, again, you can see the main word here is appropriate. So be it verbal, non-verbal, or even confidence, use it appropriately. And what is this appropriate means? So again, it comes from different people might understand appropriateness differently, or might exercise their appropriateness differently. So that is why it is important to always know the boundaries. Okay, the boundaries between patient and pharmacies, the boundaries between friends. So it is different. So when you want to use all these, you have to know the boundaries. Creating a safe space. So this is actually part of rapport, building rapport as well. So again, building rapport of respect, same as empathy. So that's why empathy and building rapport is, I would say, hand to hand. Okay, so it's part of rapport, it's part of empathy, and it's part of building rapport. So that's why some things you will find the same. So respect, ensure privacy and confidentiality, ensure the environment is safe, safety and security, provide correct information. So again, in what situation you might use this, like creating a safe space? I would use, for example, a patient who has paranoid schizophrenia or very severe anxiety. Okay, so if the patient comes to the counter and say, oh, is this hospital safe? Is this out of nowhere? I think I heard voices saying this. Or, is this hospital safe? Is this? So that's where you have to create this safe space for the patient. Okay, so ensure the environment is safe for them. Like, yes, and why? For example, like, okay, so we have, if you feel scared, if you, okay, we have, you can go here, or maybe if you see some behavior, bizarre behavior, for example, that maybe you can suggest the patient to go and see someone, see the doctor, for example. So do you mind if I refer you, if I bring you to a doctor, to talk to your doctor, even though they just came from seeing a doctor? Again, it's okay, right? And also ensure privacy and confidentiality. Sometimes patient might say things, can I tell you this? Is this but this is a secret, for example. So how would you handle that? So maybe what you can do is, yes, okay, this is you and me, but you have to ensure the patient, like if there's some serious or you deem it as danger or anything like that, so you have to tell someone, you have to tell the patient that. But of course, when you want to tell the patient that, you yourself have to be calm as well. You cannot get anxious, otherwise the patient will be double, triple anxious. So you have to tell the patients in a very calm way that, okay, I think it is better if I bring you to your doctor, to since you have this, since you mentioned this. Okay, so ensure privacy and confidentiality, but again, know the boundaries to what extent. Okay, and also provide correct information. This is very important as well. Do not provide information that you are not sure. And if you're not sure, you can just tell the patient that is is uh is I'll try to find out for you. Okay. Confidentiality. Again, same thing. Ensure privacy. Always need to be confidentiality if there is risk of danger, and also aware about cultural differences and sensitivity. So cultural sensitivity is very important as well. So different language and communication, different culture and different meanings. So be aware of that. Be aware of um, the persons that you talk to. Um, do you have to say like language, some slang, um, some certain meanings might be different. So if you're not sure, it's okay to ask the patient, do you mean, what do you mean? What do you, yeah, is this? So it's okay. Okay, do not hesitate to ask the patient. Okay, so this is how verbal in building rapport, how you might want to pay attention to this. So the first one is referring, maintaining consistency when referencing objects. This is maybe in symptoms or medications term. Like if, for example, the patient, you might use more clinical terms, but the patients might use more like lame, I would say lame terms, like I got headache, but actually it's actually, for example, some people use headache, some people use migraine. It might different meanings, but ensure that the patient understands what you are referring to, especially when it comes to the medications. Okay? So, technical medical term, again, simpler, straightforward word. Humor. Humor is good in building rapport, but only when you are comfortable. So if you're not, it's okay not to use humor. Just be appropriate is fine. So humor is because it can get inappropriate sometimes. So if you feel that you know the patient, maybe you have seen the patients a few times, you know the boundaries, you know how to talk to the patient, then it's okay. But if you're not comfortable, then it's okay not to use it. Small talk, say how are you doing? This is actually to make the patient feels more comfortable, especially in breaking ice, I would say, if it's the first time. Okay. So non-verbal eye contact, smiling, nodding your head. This is important as well. Do not just stare at the patient's look, because if you don't nod your head, you just look. So the patient might feel that, are you staring? Are you zoning out? So it can get uncomfortable as well. So nod your head so that you understand. Okay. Posture, eye level, forward, lead, cross arm. Cross arm is I would say in certain situation is not appropriate, because it shows that you're guarding yourself, so it's not very welcoming. So forward, leaning forward is like to show that you are listening. So all this, your posture is very important too. Okay, tone of voice, and tone of voice is very important too. Although you are, I would say, let's say it's not a angry or sad tone, but happy tone could get overwhelmed. So like tone of voice is very important. Okay, so make sure you use the right tone. Length and rate of talking. Okay, this is also in building. Sometimes we can kind of trying to overdo it, so we talk more and very lengthy. So sometimes when you talk more, you are trying to control the conversation as well. So try to um, see the appropriate length and rate of talking when you talk to the patient. Okay, so how to combine empathy and rapport in a situation. Okay, so here I use in a situation that non-compliance to medications patients, for example, here. Okay, so how can we use empathy and rapport in these situations? First is, again, understand. Understand, see from their perspective, even though it might be different from yours. Okay, so you don't have to agree with them, but you have to understand. So for non-compliance to medication, there's one way I think might help to somehow understand. Um, so this is my slow hierarchy of needs. So this is the needs, the basic. So the basic need, when we fulfill one need, then we go to another. So then this is the importance of needs. Like you see, at the base of the pyramid is the physiological needs. So that's the basic. So food, water, warmth, rest. So for some patient, maybe they don't see their health by right. Actually, it is that physiological needs, but maybe they don't see it because they feel that there are more important things that they need to do to survive, like food and water, or provide some security and safety to their loved one. So they actually don't see that their needs, their the needs to get better, the needs to get health, to get healthy is actually here in the physiological needs. So actually this could might help you to understand why the patient, some patients not be not compliance to medication. So not just based on Maslow hierarchy of need, there are other theories, there are other situations as well. But this is one of it that might help you to understand, so that when you try educate or inform the patient, you can tell the patients that but then if you want your health is actually a very basic need as well. So if you're not healthy, then how you want to find a job, for example? If you're not healthy, how you can provide for others? So that's why this medication is important for you, because it is a basic need. Okay, so that's one way. Okay, so understand one, and then convey that understanding. But of course, before you can educate them, you have to understand, convey the understanding as well. Like, I understand that you feel scared. I understand that you feel this is your need right now. Then you tell them what you want to educate and inform. Okay, but one thing that you have to bear in mind is that do not force while you are educating and informing the patient. There's only so much that you can do, but you cannot force or control if the patient really don't want to or really cannot see your perspective or cannot see the importance of medication. Maybe they will at one point, maybe after a few times, but do not force. Okay, you try to understand, convey the understanding, and try to educate and inform that. Okay, that's all that you can do for that. So maybe you can try again the next time, but you cannot force that. Okay, so yeah, so that is my part for rapport, building rapport and empathy. Okay, so do you have any questions? Because yeah, sorry, the next part will be presented by Dr. Chen in the next session. So okay, okay, how to handle the, oh sorry, okay, how do you handle challenges of conveying empathic nonverbal cues while wearing a mask or telecounseling? Okay, so again, nonverbal cues while wearing a mask is, yes, this is a challenge, I would say, wearing mask and telecounseling. So you have to you have to rely more on your words and the tone of your voice. And again, if it's non-verbal, your eye contact, you still can see. Okay, so eye contact, the way your posture, the way you show um, the way you look at the patient, so that is how you convey empathetic non-verbal cues. Okay, but of course, words is very important as well. Your tone, and the appropriate words to choose. Okay, so that's that, and of course, in telecounseling, you have to rely the most with um you have to rely the most on your words, I would say. So try to reassure, address the patient's concern, address the patient's uh, worry through telecounseling. So, and so use the words like I understand, um, and also ask them to tell you more. So the reassurance part is very important in telecounseling, so that they understand that you hear them and you are actually acknowledging the emotions or their concerns. Okay. So that I hope I answered your question. Okay. So the second one, how do we know we have established a rapport? So I think this is a very tricky question as well, especially um, for certain when you are dealing with psychiatric patients. Some patients might feel very you feel that you have established a rapport at one session, and the next one suddenly is gone. Like, why? Uh, like these patients feel cold, and yeah. So I would say when you feel that the patient can open up more to you and kind of show that you also feel that feel comfortable with this patient with the boundaries, I would say. So that is when actually the building. So sometimes with patients, the rapport building is constant. It's not like just once it's built, it's built. So sometimes it takes time and it's continuously. So pay attention to that one session. If you feel that the patient is more open to you, or the patient can somehow accept your what you're trying to tell them, your information, the information that you try to tell them. So that is good enough between you and the patient. So if the patient's giving you a cold shoulder, or like maybe you feel that the patient is not accepting, then maybe you need to try to build the rapport. Okay. 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 So there's no more questions. I hope I answered all the questions.